Hello and welcome. At Conscious by Us, or the CBU, we believe health impacts all aspects of our lives, especially our progress toward creating a diverse and inclusive world where everyone feels they belong. That's why one of the goals we have is raising awareness around health equity topics. Today we are exploring a crucial topic that affects all of us: health disparities. But what do we mean when we talk about health disparities? And what is our understanding of the role healthcare professionals and the public play in addressing health disparities and creating health equity? In order to explore this topic, first we have to define some key terms. According to the CDC, health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. When we talk about health equity, here at the CBU, we see the creation of health equity as a collaborative practice involving professionals in healthcare, health industries, and wellness-focused industries. We also believe increasing public awareness around health equity is key to creating change. Health disparities refer to differences in health outcomes and access to healthcare across different population groups. These disparities are often linked to the social determinants of health. Now let's talk about the social determinants of health. The social determinants of health can be thought about as 5 areas and include the non-medical things that shape our lives. They are the following: access to quality education, economic stability, quality health care, the neighborhood and the environment you live in, and your social and community standing. Research shows that the social determinants of health impact our health outcomes possibly as much as 80%, which means that medical care may hold a smaller percentage of what might be causing an individual's poor health outcomes. Here are some examples of how health disparities show up in the real world. For instance, studies show that Black, African American, and Hispanic populations in the U.S. experience higher rates of chronic diseases like diabetes and hypertension compared to their white counterparts. Another example is access to mental health services. Rural areas often lack adequate mental health resources, leaving many without the care they need. Or consider the disparity in infant mortality rates. Black African American infants are more than twice as likely to die before their first birthday compared to white infants. Now let's talk about the ways we can impact health disparities. Healthcare professionals, physicians, nurses, pharmacists, physical and occupational therapists, social workers, and other members of the team are often uniquely positioned to address and bring awareness to many of these disparities. Our ability to have direct interactions with clients allows us to often identify, seek clarity and understanding, and mitigate some of these inequities as they arise. But before we can accomplish this, we have to be willing to engage in constant reflection and refinement of our practice. This includes professional development around cultural humility and a basic knowledge of diversity, equity, and inclusion through a health and wellness framework.
Healthcare professionals and the public can incorporate the ideas behind the social determinants of health to guide their healthcare. Providers and healthcare institutions can incorporate the social determinants of health into patient assessments. Consider factors like housing, education, and food security. Incorporating these elements into a client's plan of care and connecting clients with community resources to tackle non-medical needs.
From a public perspective, we all must upskill our ability to self-advocate and inquire about our own individual plan of care. The plan of care is exactly what it sounds like: your healthcare roadmap. If you have ever sought healthcare, you have a plan of care. So remember to ask your healthcare team to explain anything you are unsure of and what resources are available to you. Becoming an educated healthcare client is a key way the public can bring awareness to health disparities and improve health equity. Finally, we can all advocate for policy changes that promote health equity. Think about the health disparities that exist in your community or healthcare setting. What policies are in place to address them? What policies might be needed to impact them? How can you help drive policy change? And remember to support policies that increase funding for community health programs and resources in underserved areas.
Today we touched on the topic of health disparities and how we all have a role to play in addressing them and creating health equity. We encourage you to learn more about this topic. Here are a few suggested readings. And as always, you can reach out to us at our website at uw.consciousbyus.com. We hope you enjoyed this video.